I have this first slide up here because it does take a village to put together something like this where we can support the folks that have been sexually assaulted. I want to give you just a brief history. This started happening on several fronts. One of them was we had a DNP student who was getting his doctorate in as a nurse practitioner, and he was a former policeman and wanted to do something with getting sexual assault here on campus. So as his senior project, he partnered with Patty Van Hook, who was his advisor, and he spent 3 years processing and trying to develop this and make this happen. He wanted a place where sexual assault folks could come to the health clinic right there on campus and be examined. And as Kate will tell you, a lot of times she gets folks in her office that, you know, they get this close, but they just don't want her to go to the ER. So we're hoping that if we have those resources right here on campus, it will make it a little bit easier. Curtis and Patty wrote a grant for some funding from S.A.R.T, and they funded us all they could, but it was about 25% of what we had hoped for. So, but we did do training with that. We spent the majority of that getting trained. We had 2 sexual assault, certified sexual assault examiners come from Knoxville, Sally Helton and Ginger Evans, and they trained initially 3 faculty. And after that, we had the opportunity to have another 3 trained. And I want Mira to stand up. She's one of our S.A.N.E trained nurses. And a new DNP faculty, so we're really happy to have her. So we basically doubled our numbers. We had 3 trained in June and doubled our numbers, so we're really proud of that. Roz and Pam in student services have been great. They're the ones that say, tell me what you need. And I say, this is what we need. And they, okay, we have no money for that. But we go back, that's okay, you asked what I need. So we're trying to put together what we absolutely have in order to start doing exams. We are hoping to begin those next semester. Okay, we wanted to start in August, but there were just too many things in the way. So we're hoping to begin that next semester. There's some really important people up there. Some of them should be up there 2 and 3 times. I listed some of the folks involved with planning Escape from Rape that we had in September. Some were speakers, some were planners. Erica Shelton at the Family Justice Center has been part of the Sexual Assault Center. She is wonderful. She volunteered to be our advocate. So as soon as somebody calls us and says they've been assaulted, we're on the way, we call Erica. And she'll be there and support them throughout the procedure, whatever they want, and support them afterwards. She will provide resources. She will go to court with them if they would like. Okay, so we're very, very fortunate to have that. Lots of support from ETSU. We've got Michelle Bird, Donna Lockerbie Morrow, of course, Kate. Public safety's been very supportive. Okay. We have been involved out in the community. Chief Soroy, Aaron McCardle, the assistant DA, Tessa Profit, who is the only S.A.N.E trained certified nurse in Northeast Tennessee, and she is trained in both adult and child. And then Women Matter have been a constant source of support. I look forward to that the first Tuesday of every month because I can go and say, but we need this. And they're like, okay, that's okay, we'll go fund you. You know, we'll find a way to make this happen. So Ruth and Mickey and Cindy have been awesome with that. Mickey Carter, of course, developed Safe Passage, has done a lot, has been an outspoken advocate for the community. And the Department of Defense victim advocate, Cindy Humphrey, is here. And I want her to stand up and you all give her a hand. She's been voted the 2016 Veteran of the Year. Is that awesome? Thank you. That's awesome. And I made her dress up because I love her uniform. She did. She said, like, the whole thing, and I went, oh yeah, the whole thing. Okay. So what we're here to talk about today is what to say when somebody comes to you. Okay? How many of you in this room have had someone come to you and report that they have been sexually assaulted? Okay. Many of you, more than half of you. Okay. And that's great that they came. It's great that they came. The first thing I would be doing is thanking them for coming. And we are starting a new campaign here. It's called Start by Believing. It has been around for a few years. It's certainly new to Tennessee and certainly new to this area. But like all other crimes, only between 2 and 8% are false. And sexual assault is no different. So 92 to 98% of cases that reported are real. And so we're asking as a community and as supporters for you to please start by believing. Okay? All right, and this is part of their program. There is no shame when a loved one dies, when a home is lost, when a car is stolen. There is comfort and support, respect and sympathy. Yet when somebody is sexually assaulted, it can be a very different response. And part of it is people don't know what to say. Okay? So we're going to talk a little bit about that. This, to me, was very powerful. My daughter died in a car crash. Well, that's what she gets for not taking the bus. Okay? Victim blaming happens all the time. Okay? And we are all firm believers that you should be able to wear what you want, when you want, whatever time of day, and not be sexually assaulted. Okay, so how does somebody who has been sexually assaulted act, behave? What do you expect them to behave? Anyone?
I think it's always going to be different depending on the situation.
Good response, but typical ones, what do you see?
Depression or fear or...
Absolutely. They may be crying, or they may be very quiet and not responsive. They may be angry. Could they be giggling? Absolutely.
Because they can just not process it.
Right. Or if if their friend came with them, they're trying to distract themselves from this. Okay? Just because they're giggling and not crying doesn't mean they're not hurting. Okay? So these are some of the emotions that follow sexual assault. And again, just like you were saying, it can be a variety of responses. Okay? Things that we worry about long term, depression, okay? So if you know somebody that's been sexually assaulted and you see these behaviors, part of it is saying that's normal. Those are normal responses. They need to hear that. But there's something here that should definitely get our attention, thoughts of suicide and death, okay? Anytime you've got anybody that's depressed, you need to be asking them what I tell students a safety question. You know, and I normalize it. I say, I ask this of all of my patients that are feeling depressed. Have you thought about hurting yourself? Yes, ma'am.
What if you have somebody that like tells you that they want to do it, but then when you're like, okay, I'm going to report it, you're like, no.
Okay.
But you still have to.
Right. Well, my next question is, so what have you been thinking about? You know, and sometimes they will say, and most often they say, oh, I'd never really do anything. But when somebody says, well, next Friday when I get paid, I'm buying a hunting knife, that's lethal. Okay? So I would get some more information, build up trust, and then talk about it. Because that's not somebody I want to go home. That's somebody I want to get help. Okay, good question.
And can I just add something?
Please.
If you feel like it's outside of your scope, like you're not a counselor and you don't know what the repercussions are or what to do, you do not have to take on that responsibility by yourself. So you can just call the counseling center or bring the person to the counseling center. We have Bucks Press 2 number, which is just our phone number, and you press 2. or during the day we could transfer a person, and a lot of times that's a really good way to have someone to talk to for a short amount of time who can assess those situations and decide whether or not more needs to be done.
And we've got some cards up here. Please take those with you. We also have awesome magnets that I have all over my office, just because you never know who's going to walk in your office or your workplace. Okay? So, one of the most interesting, powerful things, you think about, studies show that the first person a survivor tells can greatly help the healing process. And it's all about how that person reacts, okay? So if you are that first person and you react favorably, it's going to help them move forward in the healing process, okay? So I think that's really powerful. Okay, so some things that you can say. Thank you for sharing that with me. Okay, thank them for sharing. I believe you. And again, that gets back to our statistically, we know it's true. I believe you. Many victims do not confide in others because of fear that others will not believe them. Be supportive. Do not question their story. And please don't ask for details. I mean, you may be really interested in just hearing how that played out, but this isn't really not the time to do that. Tell them it's not your fault. Most of them blame themselves, and they need to be reassured that it wasn't their fault. How can I help you now? And you're not alone. All of those are positive statements. How to listen. We want you to listen and not lecture, to be non-judgmental, friendly, concerned, supportive. Please try to avoid saying, even if you were a survivor yourself, I understand and I know how you feel, okay? You may have been a survivor as well, but you don't know how they feel, and certainly not in this moment, okay? So instead, we'd rather you reflect back on their emotions. It sounds like you're feeling sad, angry, depressed, whatever that feeling might be. What I'm hearing you say, and it seems as if you feel, and that gets them to try to think about what emotions they're having at the moment. Okay? Things that you can say, again, don't worry about these exact words, but the impression we want you to send them, the messages we want. No one deserves to be sexually assaulted, ever. Many survivors blame themselves because they were drinking, wearing revealing clothes, out late. While some survivors have lapses in judgment, all of us do, no lapse in judgment ever justifies rape. No one ever asks for it. And I know you hear this kind of all gets back to victim blaming. If you survive sexual assault, please understand that what happened was wrong and it was not your fault. Okay, so what can you do or offer to do? And again, keep in mind that rape is about power and control. So these survivors have lost their power and control. So we want to make sure, and we say this as SANE nurses, we want to make sure they understand they're in charge now. They can decide, but we're going to tell them what we have available. Okay, so first thing, get them to a safe place. And then what we would like you to do, and again, it's up to them, they can do what they choose, but if we could delay or discourage them for bathing, showering, brushing their teeth, changing clothes, if we can delay that and they decide to have an exam, we have more evidence, okay? But again, they're in charge. They may say, I am showering now, I can't stand this anymore. And that's fine, that's their choice, okay? So please support them in that. So we want to always remind them they're in control and they choose what the next steps are. Okay. Offer to take them for help. Hopefully, in spring semester, we are going to be able to offer SANE exams here on campus. Okay? Now, unfortunately, it is a pilot project, so we can only offer those exams Monday through Friday, 8 to 4:30. when the clinic's open. We've negotiated to have some call on Saturday and Sunday so that we will have a SANE nurse available 7 days a week. So if anything happens Friday night and Saturday night, by the time they wake up, if they go back and go to sleep, by the time they wake up, they can call and we can meet them on campus. Okay? We understand it would be better if we were 24/7. Unfortunately, there's only 6 of us and we have full-time jobs and more. So, but again, we hope that we'll get more nurses and eventually be able to staff this 24/7. Okay, but outside of these hours, we're going to have a call system set up, but they'll know they can call public safety, they can call 911, Johnson City Police, or the SANE nurse can do all this for them. Okay, we're going to have an advocate there with them. Plus, we've got Buck Press too. We can call our counselors and they can provide long-term support. So, again, helpful things to say. We believe you. It was not your fault. You are not responsible for the actions of others, and it is not your fault that someone decided to hurt you or betray your trust. Most people know who assaulted them. So that's a trust betrayal. These are friends. These are people they trusted. Whatever choices you made were the right ones because you were alive and you came for help. And it does get better, and you deserve support as you heal. We don't want you questioning their story, being judgmental, asking why. Why is almost never a very therapeutic question. It always makes you defensive. So seeing things like, help me understand is better. Don't ask for specifics. Don't ask them if they led the perpetrator on. Tell them what they should have done differently. Like, you should have taken the bus. Never, never, never blame the victim. Okay. We want you to know that going for a sexual assault exam is 100% free. There's no charge. Nobody is ever anywhere in the country allowed to charge for that. Okay? And that's important. And as students, they're going to be afraid they have to file insurance. And maybe they don't want to tell their parents right away. They don't need to worry about this. This is free. There will be no charges, no paper trail for insurance. First thing we're going to do is call our advocate and have them meet us there. We have to get written consent for anything that we do in order to provide treatment. Okay. Some patients may just say, I'm worried about sexually transmitted infections. I want meds for that. I want emergency, contraception, and I'm out of here. And that's fine. That's their choice. We can offer those, certainly. We can also perform a medical forensic exam, which can include a pelvic exam. And people are thinking, that's the last thing I want. I've been assaulted. The last thing they want is a pelvic exam. But there's a couple of reasons to do that. We can really look at damage and see if there's any tissue damage, okay? And I'll show you this fabulous machine in a minute that can help us do that. We want to collect forensic evidence. We want to look for evidence of strangulation, and there's some very specific things we need to do around that. We can also do a urine screen for drug-facilitated sexual assault. There is a $6 kit that can screen for at least 12 different drugs. So we're thinking if we can offer that to them, that may be enough of a screening to let us say we need to test this. Okay, if they've been strangled or have had drug-facilitated sexual assault, they really might want to think about pressing charges, okay? Strangulation, that is attempt on their life, okay? Like rape's not bad enough. So we will talk to them about that. We can contact law enforcement and provide resources for counseling, let them know about Kate and friends, okay? So, we do want you to suggest that they get medical attention. We're going to look for tissue. We can collect evidence. And again, I was saying, they don't necessarily want the pelvic exam, but that part's really brief. It's not the most time-consuming piece. It's really brief, and if you've got the equipment you need, it can be just a few swabs and photos and you're done. Okay, so we ask that you start by believing, and I've got a list of resources here to help support a survivor. Some folks have asked about what they can do to help. One of the things you can do is to help us get a colposcope. I found one for $3,000, which sounds like a lot of money, but the real ones at the hospital cost like 20 grand. This one, oops, I gotta hold on to my friend. This one is a demo model. And I said, well, we may be putting this up on GoFundMe. And the person that was gonna sell it to us said, let me know, I'll help contribute. So her boss got it down as low as she could, and then she was gonna contribute on her own, which I thought was pretty awesome. Okay, that's all I have. I'm gonna hand this over to my next partner in crime.
Judy likes to say frequently that she gets sucked into my vortex. I believe the reverse is true lately. I have been asked to tell you just a little bit about what I do. Here's what I do. They call it grassroots activism. The goal is to bring people together for a specific purpose. In this case, the purpose is to address sexual assault in the community. The resources and the gaps that we discovered and uncovered on the Sexual Assault Task Force led us to bring different trainings to this area. But back to activism. Most of us are activists because something has touched us personally. I am not a sexual assault survivor or victim. Some identify differently. I am a mother of daughters and a grandmother of granddaughters. They are my motivation. I want it to be part of my legacy that the world I leave for those who follow me is better when I leave. But I want to get back to the activism because it is important to note I look with humor sometimes at some of the circumstances that Judy brings me to. I hang out with people like Kate and Phyllis and Judy and extraordinary friends that you see at the end of the table. Sometimes they have more letters after their name than in their name, which means that they have shown a commitment to their credentials and their education for these causes. My gift isn't their gift. My gift is in finding the people to fill these gaps, connecting dots, if you will. But because I like alliteration, I've mentioned that we all need to have something in common, some connectivity, and a purpose to achieve our goals for whatever our cause is in the community. Does a problem arise? Well, sure. Do we get discouraged? Absolutely. And the people at this table and the people in the back of the room, I know I can call with something to do. Harriet Masters is sitting in the back. She's the director of the Women's Resource Center. She lives across the hall from Phyllis in Women's Studies. I know that if there's something that I need either encouragement on or help with or money to buy sandwiches for a community conversation, I'm going to call one of those two because they're going to contribute, either in physical presence or whatever way I ask. That's important. Your friends are important to make these connections. So we have to have a plan. We have a purpose. We know that we want to multiply all of the resources in the community for sexual assault survivors, and we want to multiply the S.A.N.E nurses, and we want to multiply all of the things that victims and survivors need in this community. So that's our mission, simply stated. That's our mission. Our plan is to follow through with uncovering and multiplying those resources. Now, I have a very conservative, faith-based background, even my education, which means that I was required to, in this particular setting, to sit in chapel services and hear lots of lectures that, I usually got bored at. So I was kind of interested usually in seeing the notes that a speaker would bring, because then I could guesstimate as to how long I was going to be sitting there learning. Here are my notes for this speech. So congratulations, we won't be here long for me, because you need to hear Kate and Judy and those who are at the front table. I have a constant goal of multiplying and recruiting. And so today my recruiting is twofold. The first one is, in the spring, my office, Professional Development at ETSU, is once again going to be bringing back the Tennessee Coalition to End Domestic and Sexual Violence to lead some seminars and some trainings. The very first meeting that I held with Curtis about 1.5 years ago, he mentioned to me in his training as a S.A.N.E. nurse that the number one thing that he needed were advocates. Ruth, he says, why would I get up at 2 o'clock in the morning with a victim, listen to her story by myself with no reinforcement, knowing that we increase the odds dramatically of her reporting if I have an advocate with me? I remembered that. So we offered one of those trainings this summer. I brought a sign-up sheet because I'm never afraid to ask for what's needed. I have a sign-up sheet. If you'll write down your name and your email, when I schedule this spring training, I'll let you know when it's going to happen, and you can register. And you can be part of this new program that's going to happen in the spring. The second thing that I am recruiting for today is money. I have a background in fundraising, so I'm never afraid to tell the story. Because in Fundraising 101, there's a saying, where 5 or more are gathered together, pass the hat. So here's our hat. So what's that called again?
Start by believing.
Yes, and the colposcope. The colposcope that is needed to address correctly this physical exam is $3,000. There's our jar. Here is our information for Start by Believing. Please feel free to come up and get this. Please feel free to access these women at this table and let them tell you the stories in this community about what has happened, what's going to happen, and what's happening now. A basic fundamental in speech class, right? So I've asked for advocates in the community, and I've asked for money for the colposcope. The last thing I want to leave you with is a story from last week. Last week I found myself on the receiving end of a phone call from someone I had not seen in 3 decades. Ruth, I need your help. My daughter's been sexually assaulted. It'd been more than 30 years. The only contact we'd had was on Facebook. So I responded the way I always respond. I call the people who can help. And so I did. An advocate and I went to the hospital, and I had the most interesting journey there. A young woman, my granddaughters are 10 and 7. So that's the clock I hear ticking in my head. It won't be long before they step on a college campus. And as Kate will tell you, the red zone begins the moment a freshman steps on campus and goes all the way through the holiday season. Thanksgiving, right, Kate? Thanksgiving. So I have 7-ish years until my oldest one steps on a campus. This young woman, I had never met the young woman before. She was 21, about the age of my youngest daughter, 21 years old. And she's originally from this area. And I looked in this face, and I saw the face of my youngest daughter, and I thought, this could be me as a mom. This could be me as a grandmother. We got compassionate care that day for this young woman. The nurse was amazing, amazing. The physician was amazing. I had seen them one other time before. My only connectivity, as I said, was the mother of the victim. Now, there was no doubt that an assault had happened. evidence was seen. No doubt at all. And she has chosen to follow through with counseling and has already gone to her first counseling session. Prosecution? Maybe not. Maybe, but maybe not. I'm telling you this story because I want you to remember how long it had been since I'd been in contact and seen this woman, and she called because she knows that the conversations have begun and we have turned up the volume on those conversations in this community. So we're asking you to be aware. That's your first contribution. We're asking if this is an issue near and dear to your heart, to contribute by training, by advocating. By advocating, it could be as simple as, here's Kate Emmerich's phone number. Here's Judy's phone number. We have information at the front. Avail yourself of those. But as Judy has begun saying this week in meetings, we must begin by believing. I'm excited that you get a chance to hear Kate today, so I'm not taking up any more time. My sign-in sheet will be here. The jar is here. And the bracelet is here. And Kate is here. Thank you, Kate.
I'm feeling a lot of pressure here, Ruth.
That's why you go with us.
Nobody wants to follow Ruth. I'm actually going to pass out my own. Now you're going to have papers coming left and right. This is just a very makeshift sign up for OASIS email list. No pressure on that, but if you are interested in getting emails from the OASIS program about presentations, workshops, and bigger events that we do on campus, it's a great way to hear from us. We do not overextend them. We only send a couple a semester, usually just for our more major campus-wide events and for when we are starting the FemSex group every semester, which is a closed group, so you have to start it at the beginning and attend throughout the semester. So we want to make sure people know about that ahead of time. I didn't really prepare anything super formal, and I do want to leave. I know, what is the time? Is it like 12:40? So I want to leave some time so that we can hear from Mickey and Cindy as well, or just have an opportunity for questions. But I just wanted to talk a little bit about sort of what my role is in terms of what I do with the OASIS program and as a counselor / advocate through the counseling center. So a lot of what I do involves workshops, presentations, and all sorts of different group-related activities with either classrooms, residence halls, different groups on campus like fraternity and sorority life, athletics, honors programs, different living and learning groups. And then we also facilitate the FemSex group every semester, which is a great opportunity to experience just exploring female sexuality with a group of people you get to know really well. And a lot of the work, and then we have larger programs like Red Flag Campaign, Love Your Body Day, which is coming up in mid-February, and then Take Back the Night, a week of events addressing sexual violence and relationship violence, the second week of April. And a lot of what I have learned over this is my fourth academic year here, is that my focus has been moving more toward how to catch people before they start falling into the stream, right? Like we have that metaphor, and I've seen this metaphor in multiple presentations and conferences that I've seen that Ruth and Mickey have basically planned all of them, and Phyllis. And a lot of the metaphor that we talk about that kind of comes up over and over is this idea of, desperately trying to pull people from the river after they've already fallen in. And this question of like, how do we get to the start point? How do we get to the beginning of the river and teach them how to swim? Give them life jackets. Tell them not to jump in the first place or push somebody else in the first place. And so a lot of what has come from that experience of learning and thinking and trying to construct education and programs around that is this idea of bringing in the bystander intervention, the bystander approach. We've heard a lot of these hot button terms. The White House task force under President Obama over the past couple of years has done a lot of research. They went to colleges and universities all over the country that have best practice programs that are really well known for their sexual prevention programs that have gotten results. And one of the main findings that they had was that when there is some sort of peer culture intervention, that is really effective in preventative work. So that, the hope and prayer is moving toward me not seeing so many people in my office, Judy not getting so many people in her clinic. That's our goal. And I don't want to soapbox too much about how this needs to start so much earlier than when you walk onto campus, because one of the statistics that we have is that 1 in 3 adolescents have already experienced some form of relationship violence in their life. And we know that 1 in 4 to 1 in 5 women, that's the more general national statistic that we know about how many women experience rape or attempted rape during college. That's just during college, and it's 1 in 3 women over the lifespan. And for men, it's 1 in 16 during college, and 1 in 6 over the lifespan, usually before the age of 18, which is a really large number if you've never heard that statistic before. And then there's also people who identify within the LGBTQ community, which are much more at risk for all sorts of different reasons. But some of the statistics around that, 1 in 2 women who identify as bisexual experience rape or attempted rape during college, so it's more than double for them. So these are important things to know. But because I don't get to people before college, the best we can do is get them once they're here. And like Ruth mentioned, we have the red zone, which is basically what we know statistically as well, is that most sexual assaults happen, the most frequent sexual assaults happen during the first few months of school, when a person first sets their foot on campus as a freshman until Thanksgiving break. Because they're vulnerable. And there are people who are aware of that and take advantage of that vulnerability. If you haven't seen The Hunting Ground, I really recommend watching it. I think it's still streaming on Netflix, and we've had several screenings of it, and we'll hopefully continue to do so here on campus. And that is very specifically directed toward sexual assaults on college campuses, what campuses are not doing well, and what they can be doing better. And I'm proud to say a lot of the things that ETSU is doing are very different than what is being shown on that movie. What our programming is moving toward is really giving a really broad-based understanding of healthy masculinity, gender violence, sexual violence, like where the cultural components of this come from, what is leading to these being perpetrated. Because I think culturally what we tend to do is first of all, we start by victim blaming. And asking all the wrong questions about what the victim did, what was wrong with them, why didn't they do this or that, or why did they do this or that, and the perpetrator is kind of, in our language, left even completely out of the conversation. They're not even in the question, right? And then we move to, okay, so I can get on board with it being the perpetrator's fault, and so it's all their fault, and so we need to focus on there being something wrong with just this one individual, but the rest of this campus, the rest of this community is fine. It's just this one crazy person. When the reality is that there are so many things that happen in our culture that contribute to a society of violence, of sexual violence, and of gender violence, and of relationship violence. And we all experience it. And in some way or another, we all engage in it, whether or not we even realize that's what's happening. So a lot of the focus that we have turned to is instead of focusing only on the victim or only on the perpetrator, is more on the rest of us, the greater population, because most of us usually are not involved in a specific case. If you are not involved in a case in which there's potentially identified victim and perpetrator, then you are the bystander. And the deal is that we all have a responsibility in those situations to say or do something. And I'm not specifically talking about a sexual assault being perpetrated, because it's very rare that a person is going to be present for that, nor would I encourage anyone to get involved in something that is violent. So whether that be a violent relationship or a violent sexual perpetration, you don't want to involve yourself in something that could be harmful to you. And so if that's ever the case, that's when you want to call public safety or get some help, not try and intervene by yourself. Don't be a hero in a situation in which you could also get hurt. But I'm talking about on a much seemingly smaller level with things like microaggressions. And so examples of this when it comes to sexual violence would be something like a person making a rape joke, or a person sexually objectifying another another person based on what they're wearing or their body type, or saying things about women that is very general. And then that can be said in the opposite direction too, saying things about men that are very general. Because the deal with gender violence and with making judgments and really narrow classifications of gender is, first of all, it leaves out people who are gender nonconforming or gender fluid, and it also puts us in a box that is very, very constrictive. And it's constrictive for both people who identify as women and people who identify as men and people who identify as something else. And so a lot of the work that we're doing is on bringing that to people's attention and challenging that idea and broadening our idea of what it means to be a human versus what we've been taught and what boxes we've been put in culturally, because it feels like these things are really interconnected. I'm trying to think of anything else that I think is really important to share with you. So I find it really important that we think of ourselves in that position. And in those moments in which someone makes a joke like that or says something like that, that if we stay silent, like even if you're not the perpetrator of this kind of violence, and you're not even the person who made the joke or made the comment. And so then you're like, okay, well, I'm out of this. I don't do these kind of things. I don't even make jokes about these kind of things. So I'm just pretending it's not happening and it's not my problem. But the issue is it is your problem. The unfortunate reality, one of my colleagues always says, you can't unring the bell. And it's true. Once it's out there, once that joke is out there and you were present, you can't be like, I forget, that just happened. No, you were there, you were present, you heard it. And so you have an obligation, you have a responsibility to say or do something. And it's really hard because socially we get pressured to not. We tend to conform in order to be accepted. And so if the general culture says, well, you're lame for making a big deal out of that stupid joke, then you're probably not going to say something. So a lot of the education that we do is around just having conversations with students about how to talk about it and how to say what you need to say without feeling like you're going to be completely socially rejected from your group, or what the pros and cons are of having that conversation in that moment. Because the deal is that if you stay silent, you're complicit. And statistically, we know if 1 in 4 to 1 in 5 women experience this in college, 1 in 3 over the lifetime, and 1 in 16 men, and 1 in 6 over the lifetime, that it's more than likely in a group that someone who hears you not say anything or laugh along or whatever has had personal experience, and what that communicates to them is, I'm not on your side. And there are perpetrators. And they aren't monsters who crawl out from the swamp, who look and seem different than us. They're just one of us. And so there's a possibility that they're present too. Guaranteed they're present for some of this. They've learned this from somewhere. And if in that moment you laugh along or say nothing, what you're communicating to the perpetrator is, I am on your side, without even realizing that that's what you're doing. So that's a lot of the work that we are moving toward, is providing that kind of education around really grasping and understanding and supporting the idea that rape culture exists and is a thing. Because without that, teaching you skills means nothing. Because if I don't have your buy-in, if I don't think that you believe what I'm saying is even true, I don't think you're gonna do it. I don't think you're gonna do anything. So it's that basic education around cultural issues, teaching skills around bystander intervention, and also normalizing healthy sexuality and healthy relationships, and providing just basic education on how to put on a condom, how to have conversations about consent, how to ask for help and for support around all different ideas of what sexuality is. And so that's a lot of the education that we do as well, is just basic sex ed that people are not getting with abstinence-only education or with none at all. So we're really starting with the foundational pieces, because it's harder to do all these higher tiered things when we literally aren't used to even having conversations around sex and what healthy sexuality looks like. So please get on the OASIS list if you're interested in hearing more about what we're doing. Grab an OASIS brochure, and you can check out the OASIS page on the ETSU Counseling Center website. We have all sorts of information on there. You can always email me at oasis@etsu.edu, and we can absolutely continue this conversation. You can come consult with me. You can get therapy from the counseling center, or just some support around what you want and don't want. So always feel free to reach out to me if you have any questions, concerns, or ideas. Thank you.
Be careful if you make friends with us.
Yes, do be careful because we're a bunch of old liberals. Not you, Kate, and not you, Cindy, but the rest of us. We're getting there. But I guess that's my main claim to fame. And what Kate just said about giving people instruction and being supportive. My grandson went to Science Hill High School, and we were talking about sex education a moment ago. He came home and he said, you know, they've taught us to use condoms, but they've never said anything about how, and you were the only person in the family I felt comfortable asking. Now, I find that humorous, that, you know, here is a 16-year-old boy, the only person he feels comfortable asking is his grandmother. So we had that discussion, and I found out later they weren't allowed to show him how to use a condom in class. And I suppose you all know we no longer have sex education in this county because it was so successful. Our pregnancy rate dropped, and after the pregnancy rate dropped, they didn't have to continue the program. So it was a way to keep costs down, and they could add that into the budget somewhere else. Women Matter also fought that. And I would like to invite all of you to come to a Women Matter meeting sometime. It is the first Tuesday. We have men who come too, and we're always happy to see you guys here. We need the support of the entire community, and Women Matter is not about men bashing. We don't do any of that. We don't bash anybody. It's all about elevating the human condition. And the only way that we're going to change things is one mind at a time. And by being a good example and showing people understanding and saying, I believe you, that's a way for a start. So I hope some of you will come to a Women Matter meeting sometime. We'd love to see you. We have good snacks too. Thank you.
Thank you for having me, even though I didn't know I was talking or anything. Just found out I was coming yesterday, so there you go. And I had to dress up last night. Thank you for inviting me. I always like to come and talk, especially on this subject. And I just wanted to piggyback on what Kate said. In the military, our culture has always been exactly what we're trying to combat. The sexual lewd jokes and the objectifications and all that. And we have been, over the last 6-7 years, really trying to combat that. And we have bystander intervention training, and it is all about everybody stepping up to the plate and saying, that is not cool. You will not do that anymore. And it is a learning process. It's been 6 or 7 years, and we have baby steps, but we're getting better. We've always been taught to suck it up, buttercup, and drive on and deal with it, and don't worry about it. Now we're trying to get these people to understand that yes, you can ask for help, and it's actually stronger to ask for help than to go, bite your lip and go on, because that's what we've been taught for 20, 30, 40, 50 years. We don't ask for help, that we drive on. But it's been a culture change in the military too. It's been a slow one, but it's coming along, because there's not many of us right now that are victim advocates, but I'm proud to say I'm one of the lone wolves up in this area. And I'm going to try and see if I can volunteer my services at ETSU as well, even though whether they have a card or not. I'm going to get that permission this weekend, hopefully. So yes, we too do this intervention there, at least yearly. Some units do it quarterly if they have the culture that demands it, and there's some that do. But if anybody has any other questions, that's all I've got.
I just want to make one other remark. I was fortunate enough, I got an ETSU presidential grant in aid, and they funded me to do a preceptorship at a hospital that sees 1,700 cases of violence a year. So while I was out there, I learned a great deal. I also learned that there are about 500 S.A.N.E programs in the country, but only about 4 or 5 of them are open 24/7, where there is a designated forensic nurse examiner that patient walks in and is priority. Okay, in a typical emergency room, sexual assault is, we do our ABCs. Are they breathing? Are they bleeding? We go through those kinds of things. If not, they can wait. And that's how it is most places across the country. So we are designating a nurse to be on call and give undivided attention to that patient, and do so with our advocates and our counselors and support. So just want to let you know that little piece as well. Okay, are there any questions? We are right up at 1 o'clock.
What are the hours of the same nurse at the Mexican?
They're 24/7.
They're on call.
They're on call. You can go to the med center, and I believe they do all their exams at JCMC. So, and that's where our students have been going all along. But they're on call, but they also might be staffing. In other words, they may be responsible for being a staff nurse, even though they've got those skills. And that kind of sometimes causes a bit of a delay.
Yes, it's good to call if there's ever a situation if you want to help someone get there. It's good to call the city medical center ahead and say they got someone coming, so that they can call the sexual assault nurse examiner, so that it doesn't take longer.
And here's a point of clarification as well. When you check in at the front desk of the Johnson City Med Center, please let them know you're there for sexual assault. Otherwise, you'll sit out in the waiting room, because they do have a place out, not in the waiting room, your own special place, so that you're not in with the general public. Make sure you tell them that when you check in, so that way they take you back right away and you're not sitting out in a crowded waiting room.
I've got a question for Kate, just so that the folks here know. All of your counselors, can they go to the hospital with someone? All of your counselors?
Yes.
So once they call your office, whoever's on call or whatever.
Well, the way that it works is Bucks 2 is a phone, it's a mental health helpline that is contracted with ETSU, and it's contracted with many universities. So it's not, when a person answers the phone on Bucks 2, that's not the counselor on call in person here. So that's where they start. And then if it is the one time, usually we can function remotely by phone, but the one time that we need to be in person is if someone's been sexually assaulted and they want someone there with them in person. So what would happen then is they would let the counselor on the phone know that they've been sexually assaulted, they want the counselor on call, and then that person would call the physical person from the counseling center who's on call, and they could meet them wherever their residence hall. So we can't transport the person, so worst case scenario, if they absolutely have nobody to bring them, we can ask public safety to. We try to avoid that because it feels stigmatizing, it feels uncomfortable for students to ride in the back of a police cruiser, even though they're not in trouble. It's only as the service to transport them. So we try to, get something figured out, like can you have your roommate or a friend drive you and meet you at the hospital, or whatever needs to happen, or we meet them, at their residence hall, or wherever they are, just to talk through things and decide what it is they want to do. But yes, if they need a person in person after hours, the counselor on call is available for that.
What about for students that don't live on campus?
For students who don't live on campus, yeah, that's a little more complicated because we can't really go to somebody's house or somebody's apartment. So if they were agreeing to the sexual assault nurse exam, we would meet them at the Johnson City Medical Center. And then if not, and they really needed to have someone in person, we would try and figure out a way to meet them somewhere on campus.
I know it's 1 o'clock. If any of you have time to stay, we would love for you to be in a picture with us, holding this up and kind of committing to begin by believing. That would be awesome. Okay? Thank you so much. Appreciate it.